The chances of transferring HIV virus from a HIV positive pregnant woman to her fetus is how much? So this is the question for you. What are the options? 25%, 60%, 80%, 90%. See, the risk of an HIV positive pregnant woman transmitting the virus to her baby without any intervention is estimated to be between 15 to 45%, and with 25% being a commonly cited figure. However, with appropriate antiretroviral treatment and other preventive measures, the risk can be reduced to below 5%. So it is crucial for a pregnant woman to be tested for HIV early in their pregnancy, and if positive, to receive necessary care and treatment to reduce the risk of mother to child transmission. So the answer here is A, 25%.